Hi, my name is Andrés Patiño, and welcome to this talk about preparing for a global health clinical experience. And thanks to Dr. Alex DeGenakis for the invitation to contribute to the Global Health Resident Longitudinal Curriculum. And I am an assistant professor of emergency medicine at Emory University. I am also the current chair of the ACEP International Section. I've been the ACEP ambassador to Ecuador and deputy ambassador to Colombia for several years, and I'll be telling you a little bit about my experience and some of the tips for engaging with global health through clinical work. So I grew up in Colombia, South America, and I moved to the US as a teenager. So I grew up in between countries, and as I developed as a clinician, I kept my interest in Colombia and just um, seeing some of the issues in global health and some of the opportunities for growth. I wanted to be learn about global health and find ways to one day contribute to improving emergency care globally. And so, as a medical student, I met the ACEP ambassador to Colombia at the time. And through his help, I was able to make contacts and rotated to two different sites. So my first rotation was in the city of Cali in Colombia at Fundación Valle de Lili, which is one of the nicest hospitals in the country, if not in the region. And it had a very well-resourced emergency department, and it was one of the few places in the country that had emergency medicine physicians at the time. So I had the chance to rotate at a site that had a lot of expertise and a lot of resources. And I spent a month there. So great clinical cases, learned a lot about the Colombian perspective on emergency medicine and healthcare in general, learned about their system. And so kind of the different pathology that I was used to in the US. Then I did a month there, and then immediately after I did another month, this time at Hospital Universitario del Valle, which is a large public referral hospital, a huge training facility. Lots of Colombian doctors have trained there, but also very challenged in terms of material resources. So a lot of expertise, but not as much material resources. I did a trauma rotation there. Unfortunately, Cali had very high trauma at that time. And so it was an opportunity to learn from trauma doctors and trauma teams about management. And also I learned a lot about kind of medicine in low resource settings and training in a low resource setting and some of the challenges that patients and clinicians face there. Next, during residency, I had the opportunity to go to Sagam, which is in rural Kenya. There's a small hospital there through kind of a collaboration of nonprofits and universities, both in the US and there. And I went there as a kind of a visiting kind of senior resident in an education role. So they didn't have residents yet, but they had interns and medical students and um, kind of clinical officers, which is kind of the equivalent to PAs and NPs here. So I rounded with them. I had educational sessions. I taught about EKGs, trauma, just in general, a lot of kind of education during that month, and it was awesome. If Hospital Universitario was low resource, Agam was even lower resource. But again, it was nice to see that even in low resource settings, you can, through knowledge and expertise, you can help uphold human dignity and improve lives, even with all the challenges. And then lastly, I had an opportunity also towards the end of my residency to spend a month at Mirabile, one of the Partners in Health, or probably the largest partisan health hospital in Haiti, and with, again, lots of expertise, lots of training programs there. And I work with, they had residents and they were about to graduate their first residency class in emergency medicine, which was really exciting. And again, lots of challenges, social challenges, environmental challenges. As you can see, there's a pretty polluted river that went by the hospital. And but it was, again, great to learn about starting a program in emergency medicine. And we think of emergency medicine as a pretty high, like a very resource intensive specialty. It's like, what can you actually practice emergency medicine without a CT scan and an MRI and all the technological things? And the answer, what I learned from this experience, that yes, you can always bring emergency medicine expertise to see patients and undifferentiated patients and diagnose them and treat them appropriately. And secondly, to expedite processes and see people quick so they can go back to their livelihoods. So when someone has to take a whole day out of work to be in a waiting room, they're missing out on their livelihoods, especially if in this very limited resource setting. So when you bring expertise that can help them get back to work and back to their lives and caring for their families, you're actually contributing to their livelihoods and their dignity. So we have, as a specialty, a lot to offer, regardless of the resources available. All right, so those are my experiences there. In addition to clinical work, I've had the opportunity to do research in different settings and work in some leadership programs, but that's outside the scope of this talk, and I'm happy to chat some more offline. So that's me. And so now let's talk about how to prepare for this sort of activity. So we'll talk about how to find opportunities and how to prepare for the types of global health clinical experiences that are out there. And then most importantly, we'll be talking about the do's and do's and don'ts during your clinical experiences. And we could spend hours and hours going in depth, but this is a very short talk. So I'll provide some resources at the end that you can use to go a little deeper. I'm also available as a resource if you have questions. You'll see my email address at the end. And so this is just a little taste, a little primer to get you started. So what are the types of clinical experiences that you can get in global health? So I think what I see most commonly for people in training is observerships, where you basically go and shadow a clinical team in another country and you learn from, just observing. It's easier than to set up a full rotation, which is when you actually join the clinical team and actually examine patients and do procedures and integrate into the clinical team. When you do a clinical rotation, and it usually entails more paperwork. You're talking about more like liability and so to become integrated into a clinical team takes more paperwork. Then as a resident, what I've seen is some of the things that I did as a visiting educator, where you are less in a direct care role, but you come and you kind of share if it's a place that maybe doesn't have senior residents yet, maybe they don't have a residency at all, then there's an opportunity for you to kind of do didactics, help with the educational program of the facility, and kind of have an exchange in terms of learning and help, advance whatever educational project is on site at that time. Then is the medical mission. So these are like the mission trips. A lot, when a lot of people hear mission, you think about churches and other NGOs that go for a short term. And it usually entails direct clinical care or just helping the clinicians provide direct clinical care. But what distinguishes this is that it's usually um, less educational, tends to be more direct care or addressing some other social determinants through a program, and it tends to be very short term. So like a couple of weeks as opposed to a month or more with other clinical experiences. Then there's language courses, so you can, and this tend to be out of pocket. You want to learn Spanish, so you go pay and you have a dedicated class time for part of the day, and then there may be a shadowing component or some other exposure to clinical medicine in another country. And then I think a lot of people who are just starting to learn about global health haven't, imagined themselves going straight to like the front lines of the most acute humanitarian crisis of the moment and provided clinical care. This is hard to do as a resident, and I do not recommend it. That even as an attending, you need to have enough preparation, you need to have been abroad enough, be familiar with travel, be familiar with other settings, with safety concerns, be familiar with providing care and outside of your normal setting, uh, before you even consider providing care in a dangerous kind of active conflict or active human or natural, man-made or natural disaster. So usually it's not within the scope of residence, especially because of the time constraints of residency as well. So if you only have a month to go somewhere and it has to be this specific month on the calendar year, it's probably going to be pretty hard to get an acute humanitarian relief experience. But if this is something that you're interested in, uh, getting experience in some of these other through these other avenues will definitely can start setting you up for humanitarian relief work later on. Um, because you definitely, when you start applying to Doctors Without Borders, MSF, or other NGOs, they're going to want to see that you've had some experience abroad, that you've been exposed to clinical care in other settings, and that you get it, that you're not going to go somewhere and totally lose control or freak out or come right back. So, but acute humanitarian relief work is something that you have to build up towards. So, and just off the bat, we'll start with the take-home points and we'll revisit them at the end. Just as part of adult learning theory, we'll do a little bit of spaced repetition. So overall, I think global health clinical experiences offer invaluable learning. So you get and perspective. So you learn about medicine, the medicine that you already know, you see from another perspective. You through your exchanges with colleagues from other countries, you think more critically about what you do and why you do things clinically. You think about resources and social determinants of health. Uh, you may bring things back about like, well, maybe if I do a better physical exam, I don't have to use as many resources back in the US. So it's an exchange. It's invaluable in terms of learning and gaining perspective about medicine and the world. But there is a significant risk of negative, unintended consequences from these clinical experiences, and obviously unintended. Everyone wants to go and help advance care in another country, but I want you to be aware of kind of some of the potential pitfalls and start adopting some of the best practices to avoid those potential negative consequences that going abroad could have for you and for the host country or community. So in order to mitigate those potential unintended consequences, I offer 5 guiding principles. So one is decolonizing attitudes and practices, and we'll cover this in a little more detail. Practicing cultural humility, avoiding unintended consequences of well-meaning actions, being safe and being prepared. So how to find a global health clinical experience. So for observerships, rotations, and visiting educator opportunities, they're often kind of the ones that are most easily set up are through your own residency and medical school. So a lot of residencies in medical schools don't have global EM faculty, and so for people who are in a program that does not have kind of easy connections to global health, you can definitely reach out to faculty from other universities and programs. And most of the time, they're going to be very happy to connect you with different opportunities. Same with NGOs. If you don't even know where to start, but maybe you have a country of interest or a region of interest, you can reach out to the ACEP International Ambassador Program or the International Section, and you can start making contacts that way. If you say, hey, I'm a resident and I'd like to try to do a clinical rotation in country X, if you email the program, they'll try to direct you to either an ambassador for that country, or if there's no ambassador for that country, they can direct you to someone in the region who can kind of help network. It will take multiple emails, but I'm pretty sure you'll get in touch with someone who can help you find some contacts in the region and try to set up a clinical experience. You could potentially reach directly to so let's say in my case, I really wanted to go to Colombia. And so Colombia is a country that has a pretty advanced medical care and universities. So you could go directly through them. A lot of them have already processes for external rotators or visiting residents who, and they'll just tell you, hey, you just have to do this paperwork. Obviously, you have to work with your program and or university to make sure that you're doing all the paperwork that needs to be done and on the United States side, so you're not messing up your salary for the month, and that you're covered, that you have insurance, that you have everything to be safe and covered on both sides. For mission work, you usually reach out directly to the NGO or the organization. Most of them have websites that you can just go directly through them. Same with language programs. They're pretty easy. You just reach out to them directly. So factors to consider when you're choosing a global health experience. So one is or the first bucket is personal. So what are your language skills? Obviously, if you speak the language, you're going to get a lot more out of your clinical experience than if you don't. What are your countries or regions of interest? So you can narrow your focus if you have one. And then any pre-established connections, like I was mentioning, through your program, family, any other contacts that you can start networking through. The time frame is really important because usually residents are really trying to squeeze this into their program. You know, you have a set calendar for the year, and so what is actually feasible for the month that you happen to have off. The cost. A lot of times you have to cover at least part of the cost. Maybe you find funding for room and board, but you have to pay for the flight, so something that has to be factored in. Or maybe you're lucky and you find funding for everything. And then residency salary considerations. This varies a lot by program, but at Emory, for example, we have to make sure that we go through residency leadership, and some like moves have to be made to make sure that the salary is covered because of the way it's funded. That sometimes like normal salary can't be earned during your stay abroad. It's just not covered. And so, but programs that may have different buckets, different ways to cover this. And so definitely get your residency leadership involved as you start thinking about this. And then the other bucket is the organization you're working with. And we'll talk a little more on this later, but you want to go with a reputable organization. What is the organization actually trying to accomplish? Is it worthwhile? Is it actually sustainable? What is their exit strategy? So are they just going there for a minute and leaving and not leaving much behind? Or are they actually building infrastructure? Will the local community be better off and have something long lasting after the organization is done with the project? What are they leaving behind? Is the community actually a part of the organization? Are people who live in the community part of leadership? Are they contributing to the decision making? Are they being taken into account for the decision making, or is it all driven from abroad? Are there opportunities for bidirectional exchange? Are residents or students coming to the US, going there back and forth? Is there more of like an even exchange? So finding funding for your clinical experience is a little easier as a medical student. There's a few more grants available. There aren't a ton, but there's a few more. As a resident, it gets a little bit harder. There's the EMBRA grant. I know that they stopped during COVID for a little bit. Um, I have a couple of links here that I'll have a QR code for at the end, so don't worry too much about writing them down. But your residency program may have travel grants. And if they don't, you can make a case for maybe they have a discretionary fund somewhere that they can maybe partially fund your maybe your flight, maybe your room and board. If you make a case that that you're going with a reputable organization, this is going to be really important for your learning, that what you learn you'll bring back and talk to your residency about. If you make a good case, they may be able to partially fund some of your travel, but you have to kind of know how to sell it right, make sure that you're doing something worthwhile that they want to fund. So why do pursue a global health clinical experience at all? So and some of this I've already mentioned. So learning about different settings, learning from patients with different pathology, learning about different culture, language, social system, healthcare system. And most people want to do global health because they want to help. They want to make a difference in a place that has lower resources. And I have a few asterisks next to that because it's pretty hard to do that during your first clinical rotation or your first few kind of encounters with global health. And that's why it's so important to go with an organization, to be part of something bigger, an organization that's leaving something behind. Because as an individual just going there for a few weeks, half the time you're going to be just figuring out where you are, figuring out the system, and then the second half you're going to be doing lots of learning, and that's when you're helping a little bit, but you going by yourself somewhere with no program, with an organization that is not part of something bigger, it's going to be hard to help. So I would think for your first couple of rotations, you're doing more learning than helping. And that's okay. You have to start somewhere. And we'll talk about how to do this in a more ethical way. And so possible cons, so we talked about the unintended consequences of well-meaning actions, and then aid colonization, some of the negative stuff. So if you go with an organization that's just in and out and doesn't leave anything behind, kind of the Western savior complex where you just go and you're saving people, you feel like you're saving people, but not really listening to them or respecting them. Medical tourism where you just go there to see things and do things that you wouldn't do in your own country. Poverty porn, where you go and take pictures of people suffering and post them in your Instagram. So we want to avoid those things. And obviously the physical, emotional health risk to yourself from going to a different setting. So how can you help minimize these cons? So first we got to learn about a little bit about the origins of global health. So global health originated during colonial times, not in the same form, obviously, that we have today, but as colonial powers sought to learn about different diseases in their colonies to help people, but also mostly to advance their economic interests. And so a lot of the science and kind of the paradigm emerged from this power differential. And things improved a little, the colonies as they gained independence, uh, there was less of this kind of formal power structure, but the power differential remained. And with countries in the global north or former colonizers having strong influence over the decision making in the global south. And so a lot of times providing help with conditions, so saying we're going to give you this grant, but you have to not spend so much on on your education or healthcare. We need austerity measures to make sure that your budget is balanced. And then the decision making happening in organizations based outside of the people, the communities that were being helped. And so with that little community input. So a lot of what we see is, and as much as global health tries to evolve and become and have a more ethical practice, we still see some of the remnants of this colonial origins in terms of the economic and political structures that still are unequal. This stereotype of the global South victim and the global North savior that comes to just save the day. Lack of people from the global South in positions of power and decision making in global health. Aid without an exit strategy, so not leaving anything behind, just quick in and outs to make the helper feel good about themselves. And we talked about medical tourism and poverty polling. So how do we decolonize global health? So we need to behave in ways that promote equity and respect. So you need to value your the receiving community, the people, the host community. You need to value their experience and expertise. Just be cognizant that you are learning more than you're helping, at least the first few times around. So you have to be respectful, minimize the burden to the local community, show gratitude, and do not, especially clinically, don't do anything that you wouldn't do in your home institution. So if you don't do appendectomies in your home institution, don't go and perform appendectomies in another country or things that you're not trained for. And it may, that opportunity may arise and may be offered to you because there's, less supervision, you're in a different country, there's a power differential, but don't do it. Don't do things that you wouldn't do in your home institution. And be, thoughtful and avoid actions that promote some of the things that we've mentioned. So especially the savior-victim dynamic. Think about, how to treat people with respect and as your equals. And again, choose your organization wisely. So, and some of the factors we've already mentioned. So you want to be with an organization that has lots of community input and has community members in its leadership structure, that aims to have bi-directional exchanges, has an exit strategy sustainable. The next step is practicing cultural humility. So initially, or kind of in the 90s, there was a lot of talk about cultural competence, which was learning everything you can know about the culture you're working with. But this, we're moving away from cultural competence because this is knowledge-based, but not necessarily attitude-based. And so the concept of cultural humility emerged, which is more about, even if you don't know, you're not going to know everything about a culture or a subculture or a particular behavior of a community or group, but you can always approach that community with openness, with being curious, and always with an element of self-reflection and asking yourself, are my thoughts and behaviors being promoting bias? And we all have biases, but we just have to catch ourselves and be open and reflect. And how do we kind of challenge our own biases? And be cognizant of power imbalances and address them. So it's more about lifelong learning and openness and reflection, because there's no way you're going to learn everything about every culture, but you can always be curious and ask and be respectful. So avoiding the unintended consequences of well-meaning action. So this is, I just have a couple of examples to illustrate the concept, but there's many different ways in that you can try to help and have a negative impact. And so you just, and sometimes you don't know, but you should always try to think, what's going to happen 2 or 3 steps ahead from whatever well-meaning intervention that I try to do. So the first example is I've labeled phenytoin. So there's a hospital in a rural town in country X that has low supplies of phenytoin, and it needs it to treat its patients to make sure they don't have seizures while they're in the hospital. There's a new visiting resident physician who wants to do something nice for the hospital. They're so grateful that they're there and they want to help, and they realize that phenytoin is actually really cheap in this country. So they just go to a local pharmacy and buy a bunch of phenytoin, as much as they can buy with, the money that they have, which is, it didn't cost a lot. So it's like, great. So now this hospital has um, phenytoin for a little while at least. So the problem is that in a couple of weeks, you start having all these patients that are coming to the hospital because they're not able to find phenytoin in the local pharmacy. So they're having seizures, they're not having access to phenytoin, and so because this is a pretty rural community and it's going to be a few weeks before the local pharmacy can get any phenytoin. So, and this is a hypothetical, but you can think of many kind of permutations or ways in that small ways that you think you're helping can have a negative unintended consequence in the community. So you just have to kind of be thoughtful and talk to locals and say, hey, can I do this? Will this disrupt anything else? Another example more at the organizational level. So there's an international NGO that gets a grant and starts a free clinic in a rural town and countrywide. So there are visiting attendings and residents that provide free care to the local community for a year, and they have, it's a wonderful project because they get people on their the medical care that they haven't had for a while. Um, the problem is that before the free clinic opened up, there was one physician that had a little clinic that was fee for service that was trying to make it in this community and providing some care. And yes, he didn't see everybody in the community, but it was it was a doctor in town. Unfortunately, with this free clinic, the doctor went out of business. No one wanted to pay for his service because they could get it for free at the local clinic. So, and then furthermore, the NGO runs out of money. The grant runs out after a year. They're not able to renew it. The free clinic closes. And so now this rural town is left without the free clinic and without the one doctor that they used to have. And so again, this was a wonderful project that was helping the community, but also didn't have a good exit strategy, didn't have focus on sustainability, didn't involve the one doctor who was there. And so now this community is worse off than before the project. Okay, so next steps, being safe. So you have to focus on your physical safety, your physical health, and your mental health, both for yourself and to not be a burden for the local community. So physical safety. So when you're traveling abroad, even if you don't want to, even if you try not to, you are basically wearing a big target that says foreign. And this is from your clothing, from your mannerisms. Even if you speak the language, you may have a different accent. People can't tell that you're not from there after a few seconds of interacting with you. And usually, if you're coming from the US, people assume that you have money. And so that you should be very careful about your safety when you're traveling because you could be a target of criminal activity, pickpocketing, from pickpocketing to more serious things. So before traveling, check the State Department website for any travel advisories. And you have to work very closely. You must have both a US based and a local mentor, and you want to work with them to have kind of make your travel arrangements, your housing arrangements, your local travel arrangements to make sure that you have emergency contacts locally, that you have kind of emergency plans. What happens if, how to travel at night, what kind of public transportation can I use? And another important tip is making sure that you have a working cell phone. So talk to your local mentor about where can I get a SIM card, make sure that you bring a phone that either has service in the country or that you can that is unlocked so you can use a local SIM card. And definitely download an offline map of the area. So let's say you don't have service, but at least you have the map so you can get back if something happens to your accommodations. And definitely wear appropriate clothing. So both for modesty, to be respectful, and also you don't want to have expensive items or things that maybe are not expensive that could be perceived as such, that could expose you to crime. I also recommend that you do the UN Security in the Field course, that is free. Make copies of your passport. Um, Definitely get evacuation insurance. Your program or university, if they have, or your global health mentor will have experience with this and can refer you to how to get evacuation insurance. And make sure that you share your travel itinerary with both your mentors and loved ones. Physical health. So there are different things that you'll be exposed that you could potentially be exposed to while traveling. So definitely make a travel appointment about a month in advance to make sure that you have all the vaccines that you need before traveling. And depending on where you're going, you may need a prescription for malaria prophylaxis and make sure that you bring enough. And you also want to bring HIV post-exposure prophylaxis if you will be performing procedures. So if you get a needle stick, uh, you'll have access to this and won't have to scramble to try to find it because depending on where you are, it may be really hard. Make sure that you have health insurance that will cover you abroad, and we talked about evacuation insurance. Make sure that you bring N95, surgical mask, gloves, hand sanitizer. Just before traveling, ask if these things are easily available or if you should bring enough to be protected during your stay. Make sure that you pack enough of your own medication and hygiene products that may not be readily available where you're going. And make sure that you have a good amount of non-perishable snacks for during travel to and from, and just in case there's no easy access to snacks or food during certain times of the day where you're going. And think about your mental health. So when you travel to a lower resource setting, you will be exposed to things that will challenge you. And here's an example, a hypothetical example. So you have a patient that comes in the middle of the night and they're very septic with a distended abdomen. You do an ultrasound and you see lots of free fluid and you actually see bubbles. So now you're very concerned about a perforated viscus. There happens to be a surgeon that is able to come from a couple towns away and do surgery on your patient. And actually, they become hemodynamically stable, their decision's doing great the following day, they want to eat, they're recovering very nicely, except that their lab work shows that they're now in acute kidney failure. And you try to give them fluid, you try everything you can from a medical perspective to optimize their renal function, and their kidneys are just not recovering, at least in the short term. And so, unfortunately, the dialysis is not available in the country. It's just too expensive. You can't refer them anywhere. Even maybe there's a dialysis center in the country that is many hours away by car, and the family can't afford. You don't have a way to get them there. And so, unfortunately, this patient passes away. And so, this brings the issue of moral hazard. So, moral hazard is when you feel that you can help somebody, but you're not able to because of the system. And so you feel like this person is being harmed unnecessarily, and this harms you emotionally. And this will very likely happen to you multiple times if you're rotating in a low resource setting in different ways. This is kind of an extreme case that I've presented, but in smaller and bigger ways, you will witness people who, if they were in a high resource country, could be treated and cured, or whose life could be sustained, and that you will not be able to help or sustain their life because of the resources that you're surrounded by. And so, and this is just the system. This is not you, but you may feel like really sad, and it can be pretty traumatic for you. So you want to make sure that you're talking with locals, that you're talking with mentors, that you're debriefing, talk with your loved ones, and that you get therapy and professional help if this is something that you need help processing, because it can be pretty traumatic if you don't get the right help. Okay. Then lastly, you want to make sure that you prepare. And in addition to kind of the safety preparation that we talked about, you want to learn as much as you can about the community that you will be visiting. Um, so you want to read as much as you can about the history of the country, the region, the city, the town that you're visiting. Ask your local mentor about what pathologies are common there that you need to read about. Is it malaria? So maybe you need to refresh yourself on treatment of malaria and and maybe they have a local protocol for treatment of malaria in different populations. Is it malnutrition? So do you need to uh, read about malnutrition in children and adults, treatment, management, kind of clinical course? Make sure that you're knowledgeable as much, and you won't be able to learn everything, but you want to be as prepared as possible um, if you're going to be in a clinical experience. Ask them about the social determinants of health. So, what are the main issues affecting the population? What is it? Is food insecurity an issue? Is safety an issue? What are the social determinants there? And about the medical system, who pays for healthcare? Are people paying out of pocket? Is there national health insurance that's actually cover um, most healthcare? What is the referral system? What's the EMS system? And then, very importantly, language. So if it's great if you speak the language of the town that you're of the place that you're visiting. If you don't, you want to learn as much as possible. And usually it's really hard to learn language in a few weeks, but you want to at least pick up very basic stuff. So greetings, how are you? Thank you, I'm sorry, where is the bathroom? Um, and just as much as you can, taking a medical history. You may not be the one taking the medical history, but you'll be able to follow a little bit more with some basic anatomy terms and basic kind of chief complaints. Just do what you can, but the more you know, as long as you're cognizant of your own limitations in the language, uh, the less of a burden you'll be for your host. You'll be able to be a little more independent and learn more. So again, just a reminder, these are the take-home points. So global health clinical experiences offer invaluable learning and perspective. You'll learn so much about healthcare, about why you do the clinical things that you do. You build incredible friendships and cultural exchanges with your colleagues. Um, but you want to be careful and do it ethically to avoid the negative unintended consequences that good actions can have. And we talked about the five guiding principles: decolonizing, cultural humility, being careful about avoiding unintended consequences, being safe, and being prepared. Here is a list of resources, just links of different documents. It's definitely not comprehensive, but it's a good place to start if you want to read more as you prepare for your experience. Thank you. And here's my email. Feel free to reach out with questions.